Hey everybody, this is Edward Scarlett from Alive and Well Acupuncture. I'm an acupuncture physician here in Delray. I've been treating people for the last 25 years. Mostly what comes through my door is individuals that have neck pain, back pain, hips, knees, shoulders, all different kinds of pain. Everything from soft tissue to musculoskeletal problems. So I thought I'd just make a quick little video about when to use ice and heat because I get asked this so often. Even though I know that people can go online and look at this, and most people have used ice or heat for their own injuries or sprains or strains in their own lifetime. So if somebody does an acute trauma or has an acute trauma happen to them, they fall, a car accident, something like that, where there's a contusion, you're certainly going to want to use ice when the pain is significant. And the reason why is it's going to anesthetize, it's going to numb out the pain. And the second thing it does is it's going to bring down swelling, which means when you have trauma, blood vessels and other cells are actually ruptured and they spill out fluids, different kinds of acids and such. And this is a big part of what makes pain because it also interferes with circulation into the area. You want to get that swelling down and you want to calm down the nerve in order to get relief. Certainly with skeletal issues like bursitis, cartilage problems, arthritis, herniated disc, all respond well to ice, including long-term deep joint pain that may have an inflammatory process like rheumatoid arthritis or again a bone-on-bone situation. Long-term wise, heat's going to help in healing because it brings nutrients in, carries out acids and other debris in order to enhance repair and healing in the area. Muscles, ligaments, and tendons, if it's a low-grade sprain or strain, or if it's a low, dull, achy thing that's been going on for a long time, you're going to want to use the heat on there. Most people don't use either of these when I ask them during consultation, or certainly long enough. With ice, it's 20 minutes on, 40 minutes off, 20 minutes on. A person may do this 2 to 5 times a day, depending on the kind of injury. The heat once or twice a day, depending whether they're more sore in the morning or in the evening. So again, the heat more for dull, achy, stiff, sore, congested, old, medium grade chronic problems, especially if you put some liniment on first, camphor or menthol, and then put the heat, works very well. Ice, contusions, trauma, inflammation, heat in the joint, either from, again, an autoimmune problem or a bone-on-bone or bursa problem such as that, done especially after physical activity. So just some basics on when to use ice and heat. There's a lot of schools of thought obviously on that. One thing I will say about the ice, if you go to the gym for example and you sprain a hip muscle by doing leg presses and you put the cold on, if you rub it a little bit every 5 minutes with your hand and then reapply the ice, it will work tremendously better. So go ahead, use the liniment, use the heat when needed. Definitely use the ice often enough. And if you have some kind of pain syndrome and you're not using these are important spokes on the wheel to move people out of an inflammatory process. Take advantage of them and apply them correctly. Feel better, all the best. Edward Scarlett, Alive and Well Acupuncture.